Hello and welcome to EcoMap, the practical, easy, and useful ultrasound for general practitioners. So, a ton of you asked me for some gynecology content, and I'll put together a little something fun for you today. You'll see, I made a sort of little package for you showing some different uterine positions that I've come across. So sometimes it's a bit hard to understand the difference between anteversion, well, let's say between version and flexion, but we'll talk about that later. I put together a little package for you where we'll look at anteverted, retroverted, anteflexed, and retroflexed uteruses. So, if you like the videos I make for you, these little real clinical cases, authentic, no nonsense, nothing fake, etc. It's all real, straight from general practice consultations, totally basic in a rural doctor's office where it's hard to get imaging and x-rays, so we have to make do. In a group practice, I do ultrasounds for my colleagues in the office because we don't have a radiologist nearby and our patients often don't have a car. So if you like this, give me a like, subscribe to the channel, and leave me a comment. All of that really encourages me a lot, and I truly thank you so much for your support. It's the same thing on Facebook. A like, a quick comment, subscribe to the Facebook page. Makes me happy. The community is growing little by little. Your ultrasound training is available. The link is in the description. Join me for a great training. We're talking about artifacts. I guide you to easily get started with ultrasound. I give you tips that I myself use. I've shared these with my medical students and my residents. I explain a bit about the importance of artifacts and the mistakes you shouldn't make. What can we do with ultrasound? How do you get started easily? I set you on the right track, so you can really, like me, truly enjoy scanning your patients, just like I do today. So flexion and version, it's tough. It's hard to understand, but actually, it's something simple if you rely on basic concepts. What is version? Version is the overall angle your uterus makes inside your patient's abdomen. We're actually going to use the line of vacuity, so our endometrium, and we're going to look at our endometrium. What angle does it make in relation to our patient? If it points more toward the front, we call that anteversion. Or does it generally point more toward the back? In that case, we call it retroversion. So here's a really simple trick, and you'll see later in practice, we'll come back to it. Personally, I found this to be the easiest way to explain it clearly. If your uterus as a whole, let's not even talk about the cervix just yet. When we talk about version, we're referring to the uterus as a whole. If it maintains close contact with the dome of your bladder, that's called anteversion. If it moves away from the bladder dome and isn't in contact, or at least not closely in contact with the bladder dome, that's retroversion. It's actually pretty easy to see because sometimes it's hard. We sometimes talk about the axis between the patient's umbilicus, their belly button, and the tip of the sacrum. So we're going to make an angle. We talk about angles. Honestly, in medicine, we really have a knack for making things incredibly complicated. But I'm going to explain it to you in a much simpler way. If, on your ultrasound scan, your uterus is basically in close contact with, or at least immediately next to, the dome, that is, the top of your bladder, you're in anteversion. If it's far from the dome of your bladder, you're in retroversion. Now, let's talk about flexion. Flexion is much easier to see. In my opinion, it's a lot easier. Flexion is the angle that, this time again, is formed by your uterus, your endometrium with the cervix. I'll show you how to spot the cervix on a scan. It's actually really easy. And this cervix will bend, as you can see here, it will bend your uterus a bit like you might bend a hand. So, this time we're going to talk about that. It's called anteflexion if the uterus bends forward in relation to the cervix, or retroflexion if the uterus bends backward in relation to the cervix. Don't worry, if you're a bit lost at this point in the video, there are examples from my practice. And you'll see that once you've seen the examples, it'll seem a lot simpler to you. Just remember that there's the version. That's the overall angle of the whole uterus. And flexion is the angle of the uterus in relation to its cervix. Here's what it looks like in general. You still have our bladder in yellow here. You can see here that we have uteri numbered 1, 2, and 3 that are maintaining contact. They're close to the vesical dome, and on the ultrasound image, you can see it very clearly. If your uterus is generally in contact with the vesical dome, you can simply refer to it as anteversion. If this time your uterus moves away from the vesical dome, then you'll refer to it as retroversion. Now look at the cervix. Look at the angle between our uterus and the cervix. On the diagram, it's a little bit tricky, but in practice, it's much easier. If the angle points forward, you'll call it anteflexion. You can see here, anteflexion. You can see here, an antiflexion. So here we have anteflexed, anteverted uteri. If this time, again, our angle between the cervix here and the endometrium points forward, you have here a retroverted uterus. It moves away from the bladder, but it remains anteflexed. Here you have a uterus that moves completely away from the bladder. So it is retroverted, but also retroflexed, since this time the angle between the cervix and the uterus points backward. All right? Let's start from the basics. The bladder, the vagina, and here our endometrium with the vacuity line. The more experienced among you will have noticed an IUD here. Where's the cervix? Well, it's very simple. If you draw a line here between our uterus and a line between our vagina, the cervix is between the two. It's this big round mass. This big round mass here is the cervix. And you'll notice that just behind the cervix, there's a little bit of physiological fluid. Actually, that's the pouch of Douglas in women. I'll make a video about it. So, how is our uterus positioned here? Does it make contact with the dome of the bladder? Yes, of course. So it's anteverted. Now, when we look at the axis of our cervix and our uterus, it seems like we can see an angle here. Here we have a uterus that is anteflexed. So in this section, it's an anteverted, anteflexed uterus. That's it for the first clinical case. So for a second clinical case, we're going to go into a bit more detail. The bladder, the vagina here, our uterus present here with our endometrium. Again, right here as well. So what is the measurement actually? Actually, it's also because we have a hormonal IUD here. Here, still the pouch of Douglas with a small physiological effusion. And what is this actually? These are loops of bowel that are in contact here with our dome since the patient's head is over here. In fact, it's written there, transverse. I noticed that the notation is incorrect. This is obviously a sagittal cup. We have the patient's head, we have the patient's feet. So notice here, if we follow our vagina, we arrive at a very artifactual area, which is the cervix of our uterus. Our uterus is here. Is our uterus in contact with the bladder dome? Yes, so we have an anteverted uterus. Does our uterus appear to be flexed in relation to the cervix? Yes, strongly, very strongly. We have a very significant angle here. Since we can say that our cervix is completely curled out, our uterus in relation to its cervix, maybe even up to here, is completely bent and folded in two. So here we have a uterus that is very strongly anteverted, anteflexed. We have a uterus that's almost folded in half like a wallet. New clinical case. You'll see that here, we'll be able to observe our relationships a bit more easily in real time. So when our uterus is in the immediate vicinity, at least in front of the bladder dome, yes, our uterus is in front, even if it moves away slightly, and you'll see why, but it is always in front of the bladder dome. This is still an anteverted uterus. In fact, it's just beneath the abdominal wall, so it really is an anteverted uterus. Notice here the endometrium, the area of artifact. There's often a lot of artifact from our cervix. I'm starting the video, so our uterus, our cervix, here, this area of artifact. And if we move down a little, so still our bladder, and here our vagina. For those who noticed a little, I'll explain what this is here, what we noticed. The small hyperechoic area in the bladder. And then a small fibroid look that we see here in passing. There, it's minimal. So I'm restarting the video. You can see our uterus, our cervix, our vagina, our bladder. Well, here we have, let's hit pause. A uterus, is it in contact? Is the whole of our uterus in contact with the bladder dome? Yes, so this is an anteverted uterus. What is the angle between our uterus and our cervix? You should notice that this time, if we take the axis of our cervix and the axis of our uterus, it goes toward the back. This time, it's a retroflexed uterus. anteverted retroflexion, which gives us this very particular and uncommon shape. It's not often seen in practice, this form. In an S shape, it looks like the uterus is completely unfolded between the vagina, the cervix, and the uterus. There you have it, anteverted retroflexed uterus. And for those wondering what this little image is that we see here in the bladder, which appears highly echogenic. No, it's not a line. Actually, it's a GG catheter. There you go, a drainage catheter. Fourth clinical case. So here, nothing special, just a simple transverse section, basically just a banana shape. This time, let's switch to a sagittal view. The patient's head, the patient's feet, the vagina, the bladder dome. Is our uterus in direct contact with the bladder dome? No. It's in contact with the posterior wall of the bladder, but not with the dome. This time, it's a retroverted uterus. Our uterus is tilted backward. You can also see that our endometrial line is now pointing toward the back of our patient. Here we have, of course, the cervix, the uterus, and the vagina. What is the angle between our uterus and the cervix? Well, when we look here, it really seems like there's an angle, an arc. A bit like this, with an arc that's slightly oriented toward the posterior side, since we can see here the endometrium folding back a little before connecting to the vagina. Here we have a uterus that is retroverted and retroflexed. You can see there's quite a noticeable difference between each section. And if we've understood this whole story about the bladder dome, the version isn't a problem. And I find, personally in practice, that the flexion is still pretty easy to spot. So now, knowing how to say whether a uterus is anteverted, anteflexed, retroverted, or retroflexed, I think you've got it now. If you're still a little unsure, watch the video a second time. And then practice. Regularly place your probe on the patient. If you enjoyed this, give it a like, subscribe, that's it. Same thing on Facebook, give it a like. We're growing the community little by little. Your ultrasound training is free. The link is in the description. I'll say bye-bye and see you soon on EcoNot.